Welcome to UMCC, where your health matters to us. Kindly like, subscribe and share. Antipsychotic medications are a cornerstone of psychiatric care, primarily used to manage symptoms of psychosis like hallucinations and delusions in conditions such as schizophrenia and bipolar disorder. They can also help with severe depression, agitation in autism, and even short-term severe anxiety. The goal is to reduce distressing symptoms and help people function better in daily life. There are two main types: first-generation typical and second-generation atypical antipsychotics. First-generation drugs like haloperidol and chlorpromazine are effective but often cause movement-related side effects. Second-generation drugs such as risperidone, olanzapine, and aripiprazole are now more common due to a lower risk of those side effects, though they have their own risks. Choosing the right medication is highly individualized based on symptoms, medical history, and side effect tolerance. What works for one person may not work for another. The decision is a collaboration between patient and doctor. The aim, the lowest effective dose with the fewest side effects. With the right approach, antipsychotics can provide stability and a path toward recovery. They're not a cure, but they can be life-changing. Antipsychotics work by altering neurotransmitters, mainly dopamine and serotonin, in the brain. In psychosis, dopamine activity is often too high. These drugs block dopamine receptors to reduce symptoms like hallucinations. Second-generation antipsychotics also block serotonin receptors, which may help with mood and motivation. This dual action can make them more effective for a broader range of symptoms. The brain's chemistry is delicate, so these medications help restore balance rather than simply blocking signals. Effects aren't immediate. It can take days or weeks for full benefits. Antipsychotics don't cure the illness but manage symptoms, much like insulin for diabetes. This allows people to benefit more from therapy and other supports. Medication and therapy together offer the best chance for long-term recovery. The goal helps people regain control over their lives. After swallowing an antipsychotic pill, it's absorbed in the gut and enters the bloodstream, traveling to the brain. Some antipsychotics are available as long-acting injections, slowly releasing medication over weeks, helpful for those who struggle with daily pills. Once in the body, the liver metabolizes the drug, breaking it down into metabolites. These are then eliminated, mostly through the kidneys in urine. The speed of metabolism and elimination varies by person and drug, affecting how often medication must be taken. Doctors consider liver and kidney health when prescribing, especially for older adults. The drug's half-life, how long it stays active, guides dosing schedules. Some require multiple doses a day, others just once daily. Understanding this process helps ensure safe, effective treatment. It's all about maintaining the right drug level for symptom control. Precision in dosing is key to both safety and success. Antipsychotics can cause side effects from drowsiness and weight gain to movement problems like stiffness or tremors. Second-generation drugs are less likely to cause movement issues but can lead to weight gain and increased diabetes risk. Regular monitoring, weight, blood sugar, cholesterol is essential. Rare but serious risks include tardive dyskinesia, involuntary movements, neuroleptic malignant syndrome, fever, rigidity, confusion, and with clozapine, a dangerous drop in white blood cells. Drug interactions are also a concern. Other medications, supplements, or even smoking can change how antipsychotics are processed. Always inform your doctor about all substances you use. Most side effects are manageable, but any new or severe symptoms should be reported immediately. Never stop medication suddenly. Withdrawal or relapse can be dangerous. Open communication with your healthcare team is vital. With careful management, most people can find a medication that works for them. Safety and monitoring are as important as the medication itself. Using antipsychotics during pregnancy is a careful balance. Untreated illness can harm both mother and baby, but medications carry some risks. Some antipsychotics are safer than others. Close monitoring by both psychiatrist and obstetrician is essential. Newborns may have temporary withdrawal symptoms if exposed late in pregnancy. Never stop antipsychotics abruptly. Always consult your doctor first. Avoid alcohol and illicit drugs as they can worsen side effects and reduce effectiveness. Take medication exactly as prescribed and attend regular checkups. Antipsychotics are powerful tools but require careful, informed use. Understanding risks, benefits, and safe practices is key to successful treatment. With the right support, these medications can restore health and hope .umcc, your ultimate medical consultant connectors.